What causes low testosterone? Low testosterone, or male hypogonadism, can have various causes, and they can be classified into two main categories: primary hypogonadism and secondary hypogonadism. Let's explore each category and some specific causes. What are the congenital conditions that affect your testicles and can lead to primary hypogonadism? Congenital conditions that affect the testicles can lead to primary hypogonadism, which occurs when there is a problem with the testes themselves, resulting in reduced testosterone production. Some of these conditions include: 1. Klinefelter syndrome. This is a genetic condition that occurs in males who have an extra X chromosome, resulting in a karyotype of XXY instead of the usual XY. Klinefelter syndrome affects testicular development and can lead to smaller testes, reduced testosterone production, and a range of symptoms, including delayed puberty, gynecomastia, enlarged breast tissue, and infertility. 2. Anorchia, congenital absence of testes. Anorchia is a rare congenital condition where one or both testes are missing from birth. This absence of testicular tissue results in the inability to produce testosterone. 3. Cryptorchidism. Also known as undescended testes, this condition occurs when one or both testicles fail to descend into the scrotum from the abdomen during fetal development. Cryptorchidism can lead to impaired testicular function and reduced testosterone production. 4. Defects in testicular development. Some congenital disorders may affect the development of the testes, leading to structural abnormalities or reduced functioning. Examples include disorders like congenital bilateral anorchia or disorders affecting the SRY gene involved in testicular development. 5. Testicular dysgenesis syndrome. This is a collection of conditions that involve abnormal testicular development, including disorders like Klinefelter syndrome, cryptorchidism, and hypospadias, a condition where the opening of the urethra is on the underside of the penis. 6. Sertoli cell-only syndrome. In this condition, the testes have Sertoli cells, cells that support sperm development, but lack functional Leydig cells, cells responsible for testosterone production. As a result, there is a deficiency in testosterone production. 7. Leydig cell hypoplasia. This is a rare genetic disorder where the Leydig cells in the testes are present but do not function properly, leading to reduced testosterone production. It's important to note that congenital conditions affecting the testes can lead to primary hypogonadism and may be diagnosed early in life due to their impact on sexual development and puberty. If you suspect any issues with testicular development or have concerns about testosterone levels, it's crucial to consult a pediatrician or an endocrinologist for proper evaluation and management. Early diagnosis and intervention can help address the underlying causes and manage any related symptoms. Acquired conditions. What are the acquired conditions that affect your testicles and can lead to primary hypogonadism? Acquired conditions refer to those that develop after birth, either due to injury, infection, or other medical issues. Several acquired conditions can affect the testicles and lead to primary hypogonadism, where there is a problem with the testes themselves, resulting in reduced testosterone production. Some of these acquired conditions include: 1. Testicular trauma or injury. Trauma to the testicles, such as from a direct blow or accident, can lead to damage to the testicular tissue, affecting testosterone production. 2. Testicular torsion. Testicular torsion occurs when the spermatic cord, which supplies blood to the testicle, twists, cutting off blood flow. It is a medical emergency and requires immediate attention to save the affected testicle. In some cases, if not treated promptly, it can lead to testicular damage and hypogonadism. 3. Testicular infections. Infections of the testicles, such as orchitis, inflammation of the testicles, caused by mumps virus or other pathogens, can lead to inflammation and damage to the testicular tissue, affecting testosterone production. 4. Testicular cancer. Testicular cancer is a type of cancer that can affect the testes. Treatment for testicular cancer, such as surgery, radiation, or chemotherapy, can sometimes result in reduced testicular function and hypogonadism. 5. Testicular radiation. Radiation therapy to the pelvic area, which includes the testes, can damage the testicular tissue and affect testosterone production. 6. Certain medications. Some medications, such as certain chemotherapeutic agents, opioids, or long-term use of anabolic steroids, can suppress testosterone production and lead to hypogonadism. 7. Testicular varicocele. A varicocele is an enlargement of the veins within the scrotum. While not all cases lead to hypogonadism, some varicoceles may cause testicular dysfunction and reduce testosterone production. 8. Hemochromatosis. Hemochromatosis is a disorder where the body absorbs and stores too much iron. Excess iron in the testes can damage testicular tissue and impair testosterone production. 9. Autoimmune orchitis. In some cases, the immune system may mistakenly attack the testicular tissue, leading to inflammation and damage, which can affect testosterone production. 10. Idiopathic hypogonadism. In some instances, the exact cause of primary hypogonadism remains unknown. Idiopathic. It may result from genetic predisposition or other factors not yet fully understood. It's important to recognize that acquired conditions affecting the testes can lead to primary hypogonadism, and proper medical evaluation and management are necessary. If you experience any symptoms of low testosterone or of concerns about testicular health, it's essential to consult a healthcare professional for proper diagnosis and appropriate treatment options. What are the congenital conditions that can lead to secondary hypogonadism? Congenital conditions that can lead to secondary hypogonadism are those that affect the hypothalamus or pituitary gland in the brain, disrupting the release of hormones that stimulate testosterone production. Secondary hypogonadism occurs when there is a problem with the hormonal signaling from the brain to the testes. Some congenital conditions that can cause secondary hypogonadism include 1. Kallmann syndrome. Kallmann syndrome is a genetic disorder that affects the development of the hypothalamus and olfactory system. It is characterized by a lack of puberty and a reduced sense of smell, anosmia. The hypothalamus fails to release gonadotropin-releasing hormone, GnRH, which, in turn, leads to decreased secretion of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, from the pituitary gland, resulting in secondary hypogonadism. 2. Isolated gonadotropin-releasing hormone deficiency. In some cases, individuals may have isolated deficiency of gonadotropin-releasing hormone, GnRH, leading to a lack of LH and FSH secretion. This condition can cause secondary hypogonadism. 3. Pituitary disorders. Various congenital pituitary disorders can affect hormone secretion, including LH and FSH. For example, abnormalities in the development or function of the pituitary gland can lead to insufficient release of LH and FSH, causing secondary hypogonadism. 4. Septo-optic dysplasia, de Morsier syndrome. This is a rare congenital disorder characterized by the absence or underdevelopment of the septum pellucidum, a structure in the brain, and optic nerve abnormalities. It can be associated with hypopituitarism, where the pituitary gland does not produce enough hormones, including LH and FSH, leading to secondary hypogonadism. 5. Prader-Willi syndrome. Prader-Willi syndrome is a genetic disorder that affects multiple systems in the body. In some cases, it can lead to hypopituitarism, affecting the secretion of hormones like LH and FSH, resulting in secondary hypogonadism. 6. Empty sella syndrome. In this condition, the sella turcica, a bony structure that houses the pituitary gland, appears empty or partially empty on imaging studies. It may be associated with pituitary dysfunction and secondary hypogonadism. 7. Hypothalamic disorders. Certain congenital disorders affecting the hypothalamus can disrupt the secretion of GnRH, leading to secondary hypogonadism. It's important to note that secondary hypogonadism due to congenital conditions is typically present from birth, or becomes evident during adolescence when puberty fails to occur or is delayed. Proper medical evaluation and management by a healthcare professional, often an endocrinologist, are essential to diagnose the specific cause and provide appropriate treatment options. Treatment may involve hormone replacement therapy to address the deficiency in LH and FSH, and stimulate testosterone production in the testes. What are the acquired conditions that can lead to secondary hypogonadism? Acquired conditions that can lead to secondary hypogonadism are those that develop after birth and affect the hypothalamus or pituitary gland in the brain, disrupting the release of hormones that stimulate testosterone production. Secondary hypogonadism occurs when there is a problem with the hormonal signaling from the brain to the testes. Some acquired conditions that can cause secondary hypogonadism include 1. Pituitary tumors. Tumors that develop in the pituitary gland can disrupt the normal function of the gland and affect the secretion of hormones, including luteinizing hormone, LH, and follicle-stimulating hormone, FSH, leading to secondary hypogonadism. 2. Hypothalamic dysfunction. Certain medical conditions or injuries that affect the hypothalamus can disrupt the release of gonadotropin-releasing hormone, GnRH, the hormone responsible for triggering the release of LH and FSH from the pituitary gland. This disruption can lead to secondary hypogonadism. 3. Pituitary surgery or radiation. Surgical removal or radiation therapy for pituitary tumors or other conditions can damage the pituitary gland, impairing its ability to produce and release hormones, including LH and FSH. 4. Head trauma or brain injury. Severe head trauma or brain injury can lead to damage to the hypothalamus or pituitary gland, affecting hormone regulation and leading to secondary hypogonadism. 5. Infections or inflammatory conditions. Infections or inflammatory conditions affecting the hypothalamus or pituitary gland can interfere with hormone production and lead to secondary hypogonadism. 6. Pituitary apoplexy. This is a medical emergency that occurs when there is bleeding or impaired blood flow to the pituitary gland, resulting in damage to the gland and affecting hormone secretion. 7. Hemochromatosis. Hemochromatosis is a condition where the body absorbs and stores too much iron. Excess iron in the hypothalamus or pituitary gland can lead to dysfunction and secondary hypogonadism. 8. Certain medications. Some medications, such as certain steroids, opioids, or antipsychotics, can affect the hormonal regulation in the brain and lead to secondary hypogonadism. 9. Stress and chronic illness. Chronic stress and certain chronic medical conditions can disrupt the hormonal signaling between the hypothalamus and pituitary gland, leading to secondary hypogonadism. It's important to recognize that secondary hypogonadism can result from various acquired conditions that affect the brain's hormonal regulation. Proper medical evaluation and management by a healthcare professional, often an endocrinologist, are essential to diagnose the specific cause and provide appropriate treatment options. Treatment may involve addressing the underlying condition, hormone replacement therapy, or other targeted approaches to manage secondary hypogonadism effectively.